Good afternoon, everybody. So I'm Sandrine Simon, head of the Health and Advocacy Department in MDM Doctors of the World France. So, and I want to welcome you on our session this afternoon. I'm very pleased to welcome our three fantastic panelists that are here with me this afternoon. We have Toyin Janet Aderemi from Jordan, who is a Disability Inclusion Advisor and UNRWA. Good afternoon, Toyin.
Good afternoon, Sandrine.
And we have also Rahima Begum, coming from UK, who is a co-founder of Restless Beings. So good afternoon, Rahima.
Good afternoon, Sandrine, everyone tuning in.
And last but not least, we have Deepak Xavier, based in Kenya, who is the head of Even It Up campaign from Oxfam International. So good afternoon, Deepak.
Good afternoon, Sandrine, and everyone.
So this afternoon during the coming hour, we will discuss about the impact of social disabilities on access to crisis response, especially with the COVID, but of course it can concern every crisis that affect people all around the world, but we will probably focus more on COVID, but we will see if panelists want to also address other crises. And we would see what kind of strategy of mitigation we could have in that circumstance. So happy to welcome you again. And I just want to remind you also that you can use Twitter, the hashtag HCBerlin. So don't hesitate to do so if you want. Don't hesitate also to use the chat for comments and questions. And we will have a first round of questions among us, but I'm sure we will be happy to answer some questions later on with you. So don't hesitate to comment along our sessions. Reminding also for those who have some accessibility difficulties that you could use international signs and also live captioning during the session. So for that, you could go in the session area where you will find this option. And if you have any difficulties, there is a help desk that can guide you to use it. So thanks for that, and I think I will not take too long more because we have plenty of things to say. So can I start with you, Deepak? Could you explain us in few words perhaps what Oxfam International is doing in the field of social disability and how you address this issue?
Thank you, Sandrine. Before I start, I would like to thank MSF, Oxfam Germany, and all the co-sponsors for organizing this amazing Congress, despite all the challenges, and also deciding to focus on issues of power, privilege, and inequality. I head Oxfam's global campaign work on inequality, and that's what I'm going to talk about, and it's primarily linking the inequalities that exist and how that would, of course, impact on responses. Maybe I'll start with the story of Jason Hargrove, a bus driver in Detroit, USA. He posted a video a while back. Some of you might have seen that as well. He shared his frustration of how people were spreading the virus. And days later, after posting the video, he died of COVID. Black Americans like Jason, making up a disproportionate number of bus drivers, having been killed at 3 times the rate of white people by COVID-19. In the UK, it's 4 times. If you live in a rich area, your chance of dying by COVID-19 is halved. The richest person on earth right now, Jeff Bezos, the CEO of Amazon, could personally pay each of Amazon's 876,000 employees a one-time bonus of $105,000 US, and he would still be as wealthy as he was at the beginning of the pandemic. The economic fallout of COVID-19 pandemic could push 500 million more people into poverty, This could set us back the fight. This could set the fight of set back the fight against poverty by a decade and by 30 years in some regions such as the Sub-Saharan Africa, the Middle East, and North Africa. At the same time, 32 of the largest companies stand to see their profits jump by 109 billion US dollars, more than their average norm in 2020. And the top 100 stock market winners have earned more than $3 trillion to their market value since the pandemic. And this is very much a global story about the system that allows those with most power and wealth to push risk onto those with the least. It is the poorest people, it is women, it's racial, ethnic, and religious minorities, it's people with disabilities, Dalits, migrants, or refugees who are most significantly impacted. I think of my country, India, where I come from, where hundreds of tea plantation workers, majority of them are women, have gone unpaid since as a result of lockdown, while some of the largest tea companies in India have in fact boosted their profits. Only 1 in 6 countries assessed by Oxfam and Development Finance Institute for our Inequality Index 2020 were spending more than 100 countries. At least 1 in 3 workers had no labor protection such as sick pay, as simple as sick pay. As a result, many have faced death and destitution, and inequality is increasing dramatically. Another recent study by Oxfam revealed that wealthy nations representing just 13% of the world population have already bought more than half, that is 51%, of promised doses of leading COVID-19 vaccine candidates. To put it in a perspective, the UK government has managed to secure deals on several leading vaccine candidates equivalent to 5 dosages per head of population. So each UK citizen will have 5 doses of COVID vaccine ready. In contrast, Bangladesh so far has secured only 1 dose for every 9 people. And the story of Bangladesh doesn't stop there. Like it's pretty much like the story for most of the low and middle income countries. What I'm trying to say is the inequality crisis at its heart is about exploitation, discrimination, and exclusion. COVID-19 has put this on steroids. Yes, you heard me right. The world is on an inequality steroids now. I'll stop there. Thank you.
Thank you, Deepak, for this global overview of how crisis can affect social inequalities all over the world and increase them, even though they were, of course, already existing everywhere. Perhaps, Rahima, could you explain a bit more about your organization and so what are you doing about with COVID-19 those days?
Of course. Thank you, Sandra. It's an honor to be part of this Congress. I mean, I guess in terms of kind of what I do, I head an international human rights organization called Restless Beings, and we've been around for a decade now and work with marginalized communities. We work with communities across the world. So some of the examples of projects that we head up are women's rights issues in Kyrgyzstan, where we work with women who are forced into marriage through abduction. And this is something that happens in 18 countries across the world, quite sort of concentrated in Central Asia. We also work with communities affected by the changing citizenship state in NRC in Assam. But one of our longest running projects is working with the Rohingya community in South and Southeast Asia. So I guess today I'll be speaking from that capacity, and I'll be touching on things like the angle of capacity building and response mechanisms when it comes to global crisis. I really thought about the question of, social inequality and how it frames our response. And for me, from my sort of first-hand experience working on the ground with the Rohingya community, I can only, capacity building is the first thing that I've seen come up time and time again. For the Rohingya who were persecuted in Burma and forcibly displaced from their homeland, over 1 million now seek shelter in Bangladesh, Malaysia, India, Thailand, amongst many other countries. And so responding to a crisis of this nature and this size can be quite overwhelming and multi-layered. But also it has been an opportunity for us to really observe how these social inequalities can come to play. And that's where I guess we as an organization find ourselves in a consultative role, finding ways to better engage with local actors and international actors, and also seeking guidance from that lens, from the local lens, a lens of experience, knowing how to respond maybe immediately in the initial stage because of shared knowledge or shared cultural similarities or religion, or possibly nothing in similar, but just a shared experience of poverty or of finding means. As an example, in the summer of 2015, 8,000 displaced Rohingya arrived on the shores of Aceh in Indonesia. We were amongst a very few organizations on the ground at the time, but at first we did absolutely nothing, just observed. The local Achenese fishermen were the first to respond, and I'm sure many are familiar. This was across global news, and provided housing, food, and much needed support to survivors who were stranded on sea, the Rohingya survivors, for many, many months. They were deeply traumatized. So in that initial arrival, the local community became the first responders and were equipped to provide that initial support without any global agency or international frameworks. And sometimes I feel, just from maybe my field of work, that, and also personal experiences on the ground, is that due to the kind of structural inequalities that exist in this field, local capacities like this, like the fishermen responding, can be disregarded by international responders or humanitarian agencies. And sometimes that capacity is seen as something which needs professionalizing or needs to fit into a framework, a strategic framework. And in that process, what happens is there's confusion or inequality or a top-down approach. And that's something that I've seen, and that's something that my organization tries to combat where we can, and something that I feel really is somewhere where we as international actors can really work towards being transformative towards. So that in a nutshell, Sandrine, is kind of what I do and I guess my outlook on this.
Thanks a lot, Raima, for this snapshot, and I think we will go more in depth in a minute. Please, Toyin, can I let you present yourself and present your organization and what you are doing in the field of disabilities?
Okay, thank you very much. I work as disability advisor with the UN Relief and Works Agency for Palestine refugees. UNWA, in short, is the only UN agency that provides relief to Palestine refugees. Palestine refugees have been in protracted conflict for over 6 decades now. And specifically, UNWA works with Palestine refugees who are based in Jordan, Lebanon, Syria, West Bank, and Gaza. So in all these areas where we work, we provide services like education, health, infrastructure, and social services to Palestine refugees. And my role is to ensure that all these services are also accessible to Palestine refugees with disabilities. And of course, we have different trends depending on the country. For example, we have Palestine refugees in Syria, and right now Syria is in another crisis. So that marginalizes them the more. The same thing happens in Gaza, where there's ongoing conflict with the Israeli government. So we have these various trends. And at times we just have to, we have to really be prepared all the time so that when anything happens, we have to ensure that the interest and the rights of persons with disabilities are also protected. And I would say that in the context of COVID-19 pandemic, The already existing structural inequality came to the fore the more. Yes, they were there previously. As we all know, disability is a social inequality that results when barriers like physical barriers, like buildings are not accessible, the environment is not accessible to people who have mobility impairment, or for people with sensory impairment like hearing impairment, vision impairment, when our communication and our information is not accessible to them, is not presented in a way that they can benefit from it. Or it could be institutional when our policies, our frameworks do not consider disability issues. So we do have all these, and when these interact with these various impairments, then people are cut away, they are cut off from participating like other people in society. And with the COVID-19 pandemic, that marginalization has come to the fore the more, whereby we have there are examples of persons with disabilities who probably because they didn't have access to the information about COVID, about movement restriction, for example. Somebody was shot in West Bank, he's deaf, he didn't know there was a restriction in movement. So he was moving about and he got shot. And, you know, it's just there that people do forget that there are some people who may not be able to access the information that they are providing. They forget that there are some people who may not be able to access the kind of health services that they provide. We have cases of children with disabilities who were not able to access the education that was provided remotely for children during the school closure. So we have all these cases here and there, and what we do principally is that we apply the disability inclusion principles to remove barriers. We identify what are the barriers that will prevent persons with different types of impairment to access services, and we remove those barriers. So that's one of the inclusion principles that we use. I'll talk more later about this. Thank you.
Thank you, Toyin, and thanks for your strong testimony. Perhaps you want to continue now. Do you want to tell us more about the specific barriers you observe on the field, and if what COVID bring as more barriers ahead of those already existing?
For example, you know, when we talk about disability, disability is a social inequality itself, but we also have intersections. For example, gender. So you can imagine somebody who has a disability who is also a woman, or somebody who has a disability who is also an elderly. And for example, during COVID, due to the travel restrictions, you know, it was difficult to get assistive devices like wheelchairs, hearing aids that we normally distribute to persons with disabilities. So in some countries like Syria and Lebanon, there's also economic crisis, ongoing economic crisis, whereby probably we've planned that with this so amount of budget, we're going to be able to get this amount of assistive devices. But eventually, due to the restrictions in travels and the economic crisis, it's either we're not able to even import at all, or we were not able to import as much as we had planned. When that happens, then we have to prioritize. Then children with disabilities are more likely to get these assistive devices than older persons with disabilities. So, you know, that's where now we can see age now intersecting with disability and driving people further into marginalization. So we have cases like this. And also, there are some Palestine refugees in a country like Lebanon who are not registered. They're not registered with UNRWA as a service provider. They're not registered with the government. And now, when we talk about their legal status now, intersecting with their disability, these people are not able to access the much needed rehabilitation services because they are not registered because of their legal status. So this is another thing that happens and that complicates the experiences of persons with disabilities when it comes to crisis like we have in COVID pandemic. Then another example I can give is with education. During the period when there was school closure, government was providing remote education to children generally, but we discovered that children with disabilities were left out. You can imagine a child with intellectual impairment, a child who is deaf, who needs sign language interpretation, but it is not available by the remote lessons being provided by the government. And then what we had to do was then to approach some of our partners. We do work with community-based rehabilitation centers. Then we had to collaborate with them again to then come up with accessible curriculum for these children during that period. But the fact remains that these children do not have access to the same content or to the same quality of education that children without disabilities do have access to. That also becomes an issue because eventually they are going to sit for the same examination, but they are already disadvantaged compared with other children who do not have disabilities. So these are some of the examples that we encountered during this COVID pandemic. Thank you.
Thanks a lot, Toyin. I think it's quite powerful what you are saying to us, and we can see the social determinants, or they can shape the access to services for people with disabilities, and the intersection in between these determinants are key. I don't know, Rahima, if you want to tell us a bit more about experiences and testimony from the field you could have about this issue.
Absolutely. I cannot agree with Toyin enough, and actually I'm really glad that Toyin, you mentioned intersectionality and access to services. We've been working with the Rohingya for a decade now, and the Rohingya have been, a lot of the Rohingya forcibly displaced have moved to Bangladesh. And in 2017, as I'm sure everyone is aware, in the summer of 2017, we had over 750,000 Rohingya move into Bangladesh, at the borders, seeking refuge, desperate, at the hands of whatever happens, really, the state, at the hands of international agencies. We were amongst the organizations and still are amongst organizations that work directly with Rohingya. So we work with women, women and girls issues. We have women centers that are run by women, supporting women, and defined by how the Rohingya women want those spaces to be. Of course, that influx wasn't just an influx of Rohingya community members who came in because they were forcibly displaced. It was an influx of individuals who had gone through undescribable pain, undescribable, immeasurable trauma that they had brought. Young girls who have been raped, cases of women who were pregnant from, military rape and abuse, and amongst so many. And again, I'm sure everyone was aware because of just how much, information that was fed through the media. And so dealing with women or children or young teenagers who were accused of all sorts, who were really just, orphaned because they'd seen their parents being killed, and equally vulnerable, and finding ways to support is in itself already a huge task for both local and international organizations, not just in terms of immediate providing food, shelter, but also in terms working with, issues of, trauma, issues of sort of how to mentally support them, emotionally, psychologically, etc. And they are already marginalized, as we know. They were marginalized in Burma. They're marginalized again. That double marginalization continues, women and girls being triply marginalized, especially if you're a young woman who has been, marginalized for her entirety of her lifetime in Burma, lack of freedom, lack of ability to have freedom of choice and citizenship, but then again, living in refugee camps in Bangladesh. But then what happens when COVID strikes? Because as soon as COVID strikes, a lot of international agencies, like my own, like any others really, a lot of staff do need to return back home to isolate at home with their families. There is that sort of departure that took place in the last year of a lot of international aid workers. And then there's a sort of dependency on local support as well. And then we have the marginalization of Rohingya community members who, again, as Tuyin mentioned, also didn't know what was happening. They didn't even know initially what corona was. They had not received information about what it was. And yes, organizations did start to get the information through, but it trickled through to them. And so if you're someone, if I'm a Rohingya community member, and if I'm also a woman, if I'm also, the victim of rape, I'm also the survivor of a genocide, a modern day genocide, and I'm living in a 3 meter by 3 meter makeshift camp with my entire family cramped into that camp. That's our kitchen, our living room, our bedroom, our everything. And then suddenly I'm told about this disease, which is affecting the entire world. And I just found out about it. It's been given to me, in a leaflet. We were amongst the organizations that provided those leaflets, translated them into the language, tried to, we made our team go and, speak to as many families as they could as part of ensuring that everyone knew about the rules, the new rules. I'm marginalized. Now imagine I'm further marginalized because I don't have a toilet inside my makeshift camp. I have to walk, however many kilometers to get to that toilet, and it's a shared toilet. So how will I socially distance? And how will I socially distance inside a 3 meter by 3 meter makeshift camp if my granddad who lives with me catches COVID or is vulnerable? And so there are all these, and then what do you do if there are 1 million inside a refugee camp, congested, the world's most congested camp? How do you then find yourself in a safe space, and how do you then have access to support? And then we have the issues of local capacity as well. If so many international agencies have to depart, have to go home, have to reduce their services, and understandably so, because everyone has been affected and everyone needs to be safe, then how much has the local capacity been empowered? How much can the local community do? Because the local community are also equally afraid of this global pandemic. And so what we have now is this fourth, fifth layer of marginalization on what is already a very difficult period for a displaced community who has been forced into statelessness. And so it's not just worrying, but then it feels like this never-ending cyclic, dark hole, and how do we find ourselves out of it, and how do we provide the best support? So I absolutely can, from my experience working with the community on the ground, and equally like the Rohingya living in Aceh at the moment, the handful who are left, most of them have left now. There were 2 refugee camps as soon as they arrived. They stayed with the local fishermen and their families for some time, and then they were split into small, tiny, not refugee camps, they were more like just a sort of centers. And they were split into these 2 centers. Most have left now from then and moved on. But again, their access to rights and their access to what happens next. And then if you have a global pandemic on top of that, what does the future hold? And so yeah, that's kind of where I would like to add in terms of, the social inequalities affecting their current experiencing, at least in the light of COVID.
Thanks a lot, Rahima, and thanks for highlighting the situation of people living in refugee camps. I think it's quite important to do so, and especially women and girls living in those settings. So thanks for that. Deepak, would you want to add something else on the global picture about the situation and of social inequities living by people worldwide?
Certainly, and what Tuyin and Rahima have shared are very powerful testimonies, and I think it's you don't have to actually, from where I'm sitting right now, I don't have to walk 100 feet to actually witness that. I can just see it from outside the window, and that's how close some of us are to those examples that Toyin and Rahima have shared. And it's not like one isolated example or like an incident that is happening in a particular refugee camp or in a remote part of a country. Like it's pretty much like mainstreamed. Unfortunately, often we fail to see those deeply rooted social structures and economic structures which are actually exploiting them. So economic inequality, which Oxfam has been working quite for quite some time, which I happen to head, is we strongly feel that economic inequality is intrinsically linked to social inequality. It actually exploits the social inequality and social structure that exists, and it has built a system on to actually thrive on it. And that's basically the system that we all have in across pretty much all our countries, and that's what is the dominant global ideology or global system that is driving this world currently, and is the situation that Toyin or Rahim has talked about are outcomes of that particular system. To give certain examples, for example, women will always be the worst affected unless we challenge and dismantle the system of any not just even about the pandemic, even before the pandemic, right? It's no news that women will be the hardest hit of anything badly. Never about anything on the positive side, unfortunately. So to give you an example, women are also the more likely to be employed in precarious and poorly paid jobs. And and when the pandemic hit, any guesses who would be most affected, men or women? It's actually women, because 70% of health workers are women. So and at the forefront of providing services without adequate safety measures, PPEs are actually a lot of health workers and especially women have only actually seen them in pictures or heard about them. And if we are going to be distributing PPE kits, guess who will get it first, men or women? There is no questions about that. And also women provide 75% of the unpaid care work. That's actually looking after the children, elderly, sick, and cooking and washing, etc., etc. So the women have been subsidizing our homes and our economies, and that has gone unrecognized. And of course, so anything like pandemic happens, so the lockdowns have during the lockdown, there was a sharp rise in violence against women and girls, and that's across the world. And so women violence against women is not new news, but unfortunately the incidents have only increased, and women and girls are at the receiving end. And then you can apply more layers and it only goes to reveal. For example, a study by National Campaign on Valid Human Rights, one of Oxfam's longtime partners with whom we started actually looking at caste-based discrimination during relief, including what was provided by organizations like Oxfam or MSF and all the humanitarian organizations. What we could find, this was actually, I'm talking about 10 years ago, was that even with best efforts, actually those who were left behind are the last to receive any relief, where those actually socially marginalized are socially discriminated. And their new research, latest research in September has found that 50% of Dalit and indigenous people's households didn't even know what the symptoms were for COVID. The government and humanitarian organizations, all their information never reached them. And about 50 to 60% of households, depending on Dalits, respectively for Dalits and indigenous communities, they didn't receive the relief that was meant for them. And that's not shocking to me as a person coming from India, because it is not COVID that has actually created the situation. The situation was there. COVID is only exploiting further, and that's why I said COVID has put this inequality crisis on steroids, and it's thriving on it. It's kind of it's exacerbating the inequality that we already had. And to of course apply this intersectionality further down, of course you would see even amongst women. And you would see in different contexts, Kenya, for example, Kenya. I'm in here, Kenya. How it affects, for example, women in my upper middle class locality and how it affects actually women in the slums of Nairobi, like Kibera, for example, is totally different. And like so economic and social inequalities need to be like as I said, intrinsically linked, and we can't actually like design any response without taking into account the social structure and economic structure that actually discriminates and exploits different people differently, and it only favors the few, whether globally, nationally, even at the most grassroots level. It only like works for the few. Just to have like finish off, to kind of like how do we then like bring it on to response? So most of the responses by the governments, for example, if you have seen, it's mostly like one size fits for all, and that's never going to work. Like refugees, for example, are not are allowed to work in most countries. Like bearing very few examples, they are not even allowed to work. I grew up in a small town in India, south of India, where there is closer to home there was a refugee camp of Sri Lankan Tamil people, and I've seen them. Their lives, their children's lives started and ended in that camp, and like all they were living off like what was donated to them. Being a refugee, like you're pushed to actually like charity, and they don't need charity, they need rights. And like none of the relief packages or economic packages are not recognizing that. So unless like you provide employment opportunities, provide social protection, and treat them as human beings, as equals, and that is not going to change. And that is not this economic model that is going to tell you, like that economic model, because it thrives on those exploitations and it believes in the trickle down. And I don't know where that trickles down. Like it trickles down to maybe like the deeper of the swimming pools of the rich, or like where, I don't know. So and so any economic package, the government also needs to like whether it is government, but also equally is true for actually humanitarian actors like Oxfam's, MSFs, and everybody else. Like the whole concept of local humanitarian actors. And why does it come into play? Because it's again like unfortunately, it's true, because it's also a superior, supremacist attitude amongst the humanitarians about like flying in and flying out and providing relief and not necessarily knowing the local context. And also like how do we transfer ownership to local communities and like local actors? And I think what I'm trying to say is the system is actually designed. I'm not saying system is broken. The system has been designed in a particular way to favor the few, whether it is actually like global INGOs or national or grassroots organizations, whether it is about governments of the United States versus governments of like low-income countries, or whether it is richest of the planet and the poorest of the planet, whether it is about men or women, whether it is about refugees and non-refugees, whether it is person with a disability or not a person not with disability. So it's all about like you versus me, or like the powerful versus non-powerful, the privileged versus non-privileged. So I think like we have to, and I'm glad that Toyin and Rahima spoke about very specific examples of the sufferings and struggles of people. I'll stop here. Thanks.
Thanks, Deepak. And thanks for starting to speak about the response and what we should do about that. Please, the audience, don't hesitate to make comments and questions. I see there is some already starting, but we will try to keep minutes to answer some of those questions. But Deepak, as you have the floor, would you like shortly to say a word about this global response? You already a little bit said, but as humanitarian actors also, what we could do. Try to be short to let time to Toyin and Rahima also. Thank you.
Yeah, don't give the floor to a man, and especially from India. But I'll try to be as precise as I could. I think the bottom line for me is we know no one is safe until everyone is safe. And we need to dismantle the existing structure and systems which are working for the few to work for actually everyone to be safe. So I think like dismantling the structures and system is actually like should be part of the response. There have been, of course, like talks about building back better. There was nothing better back then, like before the pandemic hit. So we have to build a world which is actually like treating everyone equally and offering opportunities and dismantling the structure which is actually only working for the few. like, ending the pandemic will depend on how structural causes of inequality are addressed during the responses. So without addressing the structural causes of inequality, we can't actually, like, the response cannot really reach those everyone. It will only remain at a superficial level. And we talked about the vaccine. I gave one, like, an example of, like, how so if you look at actually the vaccines are being developed at the cost, like, from taxpayers' money. Like, tens and billions of dollars and pounds have been given by the taxpayers to these companies to develop vaccines, and their profits have, in the last during the pandemic, the pharmaceutical companies have increased their profits by several times, and at the same time they are going to price the vaccine so highly, so out of reach for majority of the population. So and it's our money, it's our taxpayers' money that has gone into the research, and then we still don't have. So the vaccine should be a people's vaccine, and it should be available to everyone. Otherwise, what will happen? The high flyers, the rich, would continue to actually, like, the ones who have actually spread the virus quite widely would actually, like, be safe, and those who do not have the power and privilege and money will be left behind. So I think that's very key. And of course, like, as I said, you need to apply like, intersectionality lenses in your analysis and your response. Who is already at the bottom in where you are responding, and, like, how do you actually, like, prioritize those at the bottom, and don't worry about those at the top. And they have all the means to actually, like, save themselves. Let's focus on those at the bottom. Maybe I'll stop here for now. Thank you.
Thank you, Deepak. I will let you, Rahima, continue. I see the comments go in favor of what you are saying, Deepak, and I'm sure Toying and Rahima also agree with what you are saying. But Rahima, would you like also to give us some example of how the humanitarian work can address this issue of disabilities, and how we can find ways to address social inequities in our work and in our intervention? Thank you.
Absolutely. I mean, I echo Deepak's sentiments on this, in the sense that, I mean, I mentioned earlier on, I mean, there are structural inequalities that happens. And an example that I used is local capacity building, and kind of our assumption as international organizations, humanitarian defenders, activists, etc., about what that local capacity can provide in a crisis. So, often, it's disregarded by international responders. And then there's a case of, how local capacity can fit into strategic frameworks that we create, and professionalizing that local capacity in that framework. And often that framework, comes from the global north. And that can also that's a different discussion altogether. But what it does do is it breeds confusion. It can breed inequality. It can perpetuate a top-down approach. And I feel that we have to obviously address this, top-down approach and prevent the perpetuation of it, but we have to do it in a way that is transformative. So, for example, for us to think that local response can lack capacity or requires foreign guidance is problematic, and especially when you have COVID and it's exasperated, and that local capacity isn't supported enough, or isn't given, isn't empowered, isn't given the additional resources in that time of change. It can find itself either exhausted, overwhelmed, or lacking, and then who is affected? Those who are at the other end, which the refugees or the stateless community. And so I think kind of dismantling that top-down approach is by really looking at it head-on and understanding that there is institutional racism that exists in terms of how we operate when it comes to supporting those in need. And I feel, as a result, humanitarian response should first be designed through the lens and the need of those that are affected, and then followed by that of the local responders. So in that sense, it becomes vital for us to be transformative. And I use this word quite a lot, transformative in how we collaborate, how we consult, and how we best respond to the global crisis. But also for us as organizations, to be really careful that these efforts are not performative and institutional tick boxes, but we actually work towards meaningful efforts that take into consideration all the intersectionalities that are at play. And that would mean just being consultative throughout the process. So, for example, in the light of COVID, the needs of the marginalized communities will change. And to understand that change, the cultural shifts, on the ground within the refugee camps, the new risks that exist for marginalized communities living in refugee camps, and to constantly be consultative, to also understand that the local capacity equally needs that consultation, but also needs our support. And I think if we can do that, that sort of top-down approach starts to crumble a little bit, and things do start to balance out. So I think that's kind of where my take on this would be, just to add to what Deepak was saying.
Thank you very much. We remember us that we should always adapt our interventions to the context and hear from the people that are present in the field. Thanks for that. Toyin, I want to give you the floor. So could you explain us about how to address these barriers faced by a disabled person, and with all these determinants you have explained us before? Thank you.
Okay, thank you very much. There are some actions that we call must do when it comes to addressing disability in times of crisis. And one of them is to remove barriers. Like I was talking about the barriers that exclude persons with disabilities from accessing services. We need to first of all identify these barriers. What are they? And then we remove them. We also need to identify what are the enablers, and we promote those enablers so that people can have more access to services. And really, it really comes out into play during this COVID pandemic. Everything that we've been saying about removal of barriers, it doesn't serve only persons with disabilities, really. For example, during that period, we started to provide home delivery of supplies, of food items to people, which eventually does not serve only persons with disabilities. So really, when we talk about these disability inclusion principles, they are actions that benefit everybody at the end of the day. And we've learned, it's one of the key lessons that we learned from COVID. When we talk about, somebody can work from home, somebody has a disability, then people refuse to give him or her employment because they think, you won't be able to cope, you can't come to the office on a regular basis, but this person can actually work from home, which many people did during the lockdown. So these are really principles that apply to everybody. And another thing is that even when we do that, we should also make sure that we remove barriers in feedback mechanism. Because when people are talking about how services reach them, we also want to hear the voice of persons with disabilities. How do they fare within the context of that relief, of that response? And another thing is what Rahima already mentioned, and that is meaningful participation. We want to hear from persons with disabilities. We want to consult them in all their diversity. We want to take intersectionality into account, into consideration. We want to make sure that we consult women with disabilities, men with disabilities, girls with disabilities, and across the various types of impairments, because we cannot apply one size fits all. So we want to make sure that everybody participates, not just ticking the box, but active participation. And at the same time, we want to make use of the expertise of persons with disabilities. Not only the disability expertise, we have quite many persons with disabilities who have expertise in some areas, in some other disciplines that could become useful when it comes to responding to crises like this. Then another thing is also empowerment. I like it when Rahima mentioned building capacity from the place of power. When we talk about building the capacity of persons with disabilities, first of all, we want them to know what are their rights. Many people are not even aware of their rights when it comes to humanitarian action. First, we want them to know their power. We want them to know their rights so that they can be able to demand their rights. And when they do that, we also want them to know about what humanitarian action entails so that they can fit in and they can provide their own contributions to make things easier, to make services more accessible to them. At the same time, we want to build the capacity of humanitarian actors, because for sure, they are humanitarian actors. They may not necessarily know about disability inclusion, but they need to know, because disability is a cross-cutting issue. Everybody has to know about it, because we're talking about at least 15% of the global population, which is even higher. For example, in Syria, I think in June 2020, 25% of the population in Syria has a disability. So we cannot continue to neglect that very large marginalized group. So we need to make sure that humanitarian actors know how to include persons with disabilities effectively in their response. And another thing is the issue of data. How many are they? Where are they? How many are women? How many are men? Therefore, we need to disaggregate our data by disability, age, and gender, because we need to also take care of the intersectionality. So when we do this, it is easier for us to monitor inclusion. We can have a good idea of our coverage. Who is able to access our services? Who is not able to access our services? Why are they not able to access our services? And we do this effectively by using globally acceptable standards like the Washington Group short set questions, or when we do qualitative survey, we make sure that we assess the risks and the barriers that are specific to persons with disabilities, because we want to know, so that we may know their needs and their priorities within our response. And one good thing about all these must-do actions is that when you look at them, they're actually principles that are already enshrined in protection mainstreaming, and also in the Convention on the Rights of Persons with Disabilities. And I think one good way of starting is to take a look at the IASC guidelines on the inclusion of persons with disabilities. It cuts across all levels and all types of stakeholders. It gives recommendations on what could be done at what point, whether it is preparedness, in response, in recovery. It gives recommendations, and it also cuts across all the clusters of humanitarian action. Thank you very much.
My micro was off. Thanks a lot, Stoyin, for this quite specific and important recommendation. I think a lot of people present here can bring them to their work. So thanks for that. I think there is a question from Adani Abdallah for you, Toyin. So I will just take it right now. So how do you educate the communities to actively understand and support disability inclusion initiative? Much more than ticking boxes, or do we really get community engaged? You have in few words some things to say to Adani?
Yes, thank you very much. Yeah, we do raise awareness at the community level, because when we talk about one of the key barriers to disability inclusion is the attitudinal barrier. That's the stigma, the discrimination, the prejudices. So we do engage people at the community level to raise their awareness about disability, to also clarify issues, to allay their fears, and to address misconceptions and cultural beliefs that do marginalize and stigmatize persons with disabilities. At the same time, we look within the community to identify who are the community leaders, the traditional leaders, the religious leaders, the opinion leaders that can champion disability inclusion. We identify them, we sensitize them, we train them so that they can go out there and influence the community members so that they can know more about disability inclusion and they can know how to address issues of disability in their communities. Another thing that we do also is that we identify role models with disabilities within the communities. When we do this, we also make sure that those role models know their rights, they know how to hold stakeholders accountable, and these people also play very strong roles when it comes to disability inclusion at the community level. And last is also caregivers, parents and caregivers of persons or children with disabilities. We also address them. We also address, some of them do face challenges also at the community level. So we try to know what are the kind of challenges that they face and how to address those challenges, and also build their capacity to speak up in favor of disability, in favor of persons with disabilities. So these are what we do at the community level. Thank you.
Thank you, Toyin. There's also one question for you, Deepak. It's quite a general question, but perhaps in few words, if you have some points to raise about that. So a question from Edmond Asante, or do we dismantle the structures that work for the few while the capitalist economic orientation continues to be the order of the day? And at which level of dismantling should we focus on? So you have 2 hours. No, I'm sorry. You have 2 minutes to answer this question.
I can write a thesis on that, but I'm not going to bore you all to death trying to do that. But thanks a lot for asking that question, Edmund, and it's very important. And as Oxfam and in our allies, we've been arguing for building a human economy or model, which is actually puts people first and not profits. And it's of course there are multiple stages that one go through where we can't actually stop this economy using a stop button and then move into the next one. That's not how it's going to work. We have to take what is possible today and see what is possible tomorrow, and step by step we can of course build an economy or build a system, build a society that works for everyone. And dismantling is about doing away with currently what is actually privilege, what is actually favoritism. And I think we can start from there. To start with, there are a few things that I would suggest. For example, the polio vaccine inventor, Jonas Salk, when he was asked, who wants the patent for the vaccine, he said that, well, the people, I would say. He asked, could you patent the sun? So basically, he didn't actually apply for a patent for the vaccine, polio vaccine. And it's the reality of today, from the introduction of vaccine. And of course, people like Toyin can talk about how the polio vaccine has actually saved millions of people on the planet by not patenting it and making it available. So doing away with certain, and that's what India and South Africa, Indian and South African governments are asking for people's vaccine as well, asking WTO, which holds the patent mechanism, to actually not to issue patent for the COVID vaccine so that it can be more freely available to all the populations and not for the very few. And taxing the rich, and I think that's the simplest change and we can start from, and make them pay their fair share of taxes. I'm not saying they have to actually give away all their wealth. At least pay their fair share of taxes. Warren Buffett, one of the well-known billionaires, and who I'm sure most of you know, he very famously said, "I pay less taxes than my secretary." And it wasn't actually a joke. It was actually real. And you have seen the 2021 presidential candidate and current US president, how much taxes did he pay, in the last year? So you could see, the rich can get away without paying taxes, and rest of us have to pay the bills. And at the same time, we are the ones actually left with no privileges or protection. And the other thing is, for example, right now in the immediate aftermath during the pandemic, immediate cancel of about $1 trillion worth of debt payments in 2020 would allow a lot of low and middle income countries to be able to actually provide relief mechanisms. For example, canceling Ghana's external debt payments for 2020 alone would enable Ghanaian government to pay a cash grant of $20 a month to each of the country's 16 million children, disabled and differently abled, and children and elderly people for a period of 6 months. And creation, and then the other thing that there is a special drawing rights. It's a mechanism within the International Monetary Fund, and by using that, the G20 countries and rich countries can actually create $1 trillion fund that can go about help low and middle income countries actually providing for more healthcare. And just an example, Ethiopian government itself can actually get about $630 million, enough to actually increase their health spending by 45%. One of the things that we have called for is to adequately adequately address the pandemic. The countries have to double their health spending, and countries which are actually paying interest to loans that they had taken, which should have not been loans in first place, if you free them from actually paying those debts or interest, they can actually spend on a life-saving social spending, including health, social protection, and access to education, so on and so forth. And I think the last point I would say, one of the things that we need to do is protect multilateralism and global institutions. When Trump was going after World Health Organization, hardly global leaders spoke against it or in support. There were few. I'm not saying nobody spoke, but there was actually what was at stake was multilateralism. If collapse of multilateralism, and that's one of the key I think agendas of the current model, because multilateralism would mean you find shoulders to fall back when you're actually alone, and that's what they want to do away with. So we need to actually also raise protect multilateralism, protect global cooperation. I'll stop there. Thank you so much, and apologies for taking more time.
Thank you, Deepak. Perhaps Rahima, do you have final words or some very few points you want to raise before we finish?
Tuin and Deepak perfectly summed up everything. All I can add is really, for us to, as Deepak mentioned, to really unpack and to dismantle. I think I mentioned these words before: consultative. We need to be transformative. We need to not be performative in our approach. Institutions need to, Tuin perfectly covered this. I would call it a toolkit, a set of actions that as organizations that, whether we collaboratively work on together, that can really address how to support local capacity, how to empower, place power in local capacity, but also really listen and consult and be that listening ear to the marginalized communities that we're trying to support, who are essentially at the heart of everything that we're all doing and why all of this is happening. And finally, the one thing that I would like to add is for us as institutions of change, as change makers, and we hear these kinds of words all the time on social media, and an organization like mine, which was born a decade ago out of social media, really kind of puts this at the forefront, is for us to really be change makers, is to really look at the roots of why the communities that we're supporting are in the situation that they are, and which states or which processes have put them in that place, and to not be afraid as institutions, alongside the work that we do in terms of direct aid or development work, to challenge and to ask for accountability to the states and to those who are involved in perpetrating that suffering. And I think that is something that I feel we should always come back to that, essentially, regardless of where we are within our humanitarian support services providing. So that's kind of, I think, we have to bring that back into our processes and our service providing, is eventually also our collaborative work towards seeking accountability as well.
Thanks a lot, Rahima, for that final words. Toyins, do you want to say a few words or so to conclude?
Okay, thank you very much. I would just like to say that disability inclusion is everybody's business. So we should all think about that, because we have persons with disabilities in every, all across the strata of our life, of our society. but we cannot afford to overlook the issue of disability inclusion because it affects everybody, really. Thank you.
Thanks a lot, Toyin. So I will not sum up the session, but there will be too many things to say, but that I feel very privileged to moderate this session with such wonderful panelists with strong experience and so many testimony to bring from the field. So thanks for that. Just to retain a few words, I would say intersectionality of social determinants, I think it's key. And I think we addressed during these sessions global system versus local response, which is not so easy to do, but it's very important to look at global, but answer very with local response that are rooted in the local context. And I would, my final word would be being transformative to make the things change for everybody, including disabled people, of course. Thanks a lot, everybody. Thanks the audience for being there and having very interesting comments. So I'm sure the session will continue because I saw the people want to continue discussing about it, what I see in the comments. So thanks for that. And so see you soon to continue. Thanks.